No one likes to go to the dentist. Well, most people don't. Some do, though. But keeping your teeth and gums healthy can help lower your risk of serious health problems, including heart disease, stroke, pneumonia, and possibly even Alzheimer's disease.
A good dentist is your biggest ally in the battle for oral health, and consumer man Herb Weisbaum is a contributing editor at checkbook.org, and he has advice on how to find a dentist who will make you smile, I think is a good way to put it, Herb.
Make you smile and try to keep the cost down. Yes, good morning. Most dentists rated here in the Puget Sound area get good marks from their patients, very high ratings. But when it comes to the price they pay, only 58% of Checkbook subscribers surveyed said their dentist does a good job of keeping costs down. If you're paying for this out of pocket and don't have dental insurance, you really do have to check the prices because they vary. Take a look at some prices that we found during our survey here in the Puget Sound area. For a routine exam and cleaning, prices range from about $120 to $330. That is a big difference. And look for this, an adult porcelain crown with a post and core, $1,600 to $2,500. That is a huge difference. Now, the great news is you don't have to forsake quality in order to get a good dentist. As with many services, Checkbook found no relationship between the price charged and the quality of the service delivered to you. Just a low-priced dentist are just as likely to give you good service as a higher-priced dentist.
And Herb, with some of those pricey procedures, what should you do before you agree to any treatment?
If the dentist recommends a pricey treatment, get a treatment plan. What are you going to do? Are there any options to it? And what are the prices for those treatments? You know, you'd expect a roofing company to come to your house and tell you the options, the pros and cons of repairing the roof versus replacing the roof. You should expect the same thing from the dentist. What are you going to do? Is there an option? And how much is it going to cost?
Well, so Herb, what if you're a new patient and your dentist recommends procedures that your previous dentist did not recommend, such as a bunch of fillings or crowns on several teeth, which can add up?
This is an area where Checkbook receives a lot of complaints from people. What you really need to do is ask the doctor to fully describe the treatment and why it is necessary. You know, I guess there's two options if this case comes up. Either your old dentist wasn't doing the right things or your new dentist is maybe trying to make some money by doing procedures that they shouldn't be doing. No easy way to tell. So get it in writing. And if it seems like it's a lot of money or maybe just you want to get a second opinion, get a second opinion just as you would with a doctor on a procedure that's extensive or that it's going to cost a lot of money. Your insurance company, if you have insurance, will almost always pay for the second opinion. It's not a bad idea to just have somebody else run through the records and see what they would do.
What should you do if you don't have dental coverage and you know you're going to need some costly dental work down the road?
There are some dental discount plans that are available, and you can try to look into them. Checkbook says they will save you money. The problem is most of our top-rated doctors don't take these dental plans, but it's worth a try.
All right, so should you ask a dental practice if they offer discounts? Is that what you're saying?
Yeah, and Patrick, I have a rule. It can't hurt to ask, right? Mm-hmm. Yes, say, do you have any discount programs? Some dentists we found have discounts for brand new patients. Some may have discounts for certain groups, like maybe veterans or first responders or senior citizens. So just ask, you know, I'm on a limited budget. Is there any way, if you don't have insurance, is there any way to hold these costs down? A good dentist will try to help you because they want to do what's right for your mouth and they want to do what's right for your wallet because you have to be able to afford the treatment they want to do.
That's true. You know, a lot of times you go to the dentist, you get x-rays, maybe once a year, maybe twice. What should you do or should you expect if you switch to a new dental practice? Can they transfer x-rays?
Absolutely, they can, and they're required to. You tell the new dentist, obviously you're going to wait a number of weeks before you go. Please get my records from the previous dentist. That previous dentist is required. They're your records to provide those records. And we figure that for a full dental, the full mouth, they're probably good for 3 to 5 years. So again, if they want to take x-rays, just say, is there really a reason to do this? Because I have this other set of x-rays. Let's see there. Maybe you need a specific area you want to look at. But the full mouth, maybe we don't need that for a while. You can use my old x-rays.
All right, where can we find out more, Herb?
Well, you can find out more by going to checkbook.org because we have ratings available for you for the 244 dentists that we rated in the Puget Sound area. Special deal we did with you folks at ARC and Como. Just go to checkbook.org/Como for dentists. That is good through September the 1st. And you also can listen, if you want to our Consumerpedia podcast, where we also talk all about how you can find a good dentist.
Very helpful information. Consumer man Herb Weisbaum, thank you so much for joining the conversation on ARC Seattle. Have a great weekend.
Remember, brush and floss.
All right.
Twice a day.
Great reminder. Thank you, Herb.
Okay, guys.